Hey guys, this is Sabrina here. Welcome back to my channel. So for today's video, I just wanted to discuss a few products that my son has used during this chemotherapy treatment. And as you know, he has been diagnosed with leukemia. So in order to treat leukemia, you have to go through a series of protocol treatments that include chemotherapy specifically because he doesn't have any tumor in any masses of tumor in his organs or any parts of his bodies besides the bone marrow initially. Now he's in remission and his blood, right? So there's no masses. So of course chemotherapy is what's being used. Chemotherapy does burn the skin. It does create a lot of rashes, and my son is still wearing diapers. He was in the process of getting rid of diapers, and then he got diagnosed, and that went to shit. And because we have other things to focus on, honestly. So I'm just waiting for him to become even more verbal. He understands potty training. He just doesn't like it. He's not used to it as much. So it's something that we're going to transition into it once he gets into maintenance, which is going to be very soon during the new year, 2024, beginnings of 2024. I think he's going to get to that place. So once we get to that place, we're going to potty train him. But until then, he's wearing diapers. I think he will be wearing diapers. So the reason for this video is primarily to talk about some of these products that are not targeted for babies, or they're not targeted for some of the uses that I've used it for, but they have improved my son's skin greatly and surprisingly, and that's why I want to talk about it. As you guys know, I'm a fan of La Mer products. I'm a huge fan. I've used almost all their products. I'm still experimenting with their skincare and see what works best for my skin, because I do have a tough skin in the sense that I can get acne pretty easy by using certain products. So I can get irritation, but in a form of acne. It reacts like that, but I don't get eczema or anything like that, any redness of any kind. It's just mostly acne, which is worse. So it is kind of sensitive in a sense. So that's why it reacts. It's very reactive to certain ingredients. So I have to be very careful. So I'm trying to kind of make it work, and so far it has been fantastic. And it's just a matter of how you're using your products as well. So I've used La Mer before, years ago, once in a while, never consistently, just because they're very pricey, the products are. And when my son was diagnosed, one of the major side effects were diaper rashes, skin rashes in general, but specifically diaper rashes, and something in his mouth, like some dry mouth and some dry patches, but not very common on the rest of his body. Mostly it was near the port because of the tape. It does irritate the skin, and then the diaper rash. Those are the things that become very significant, and significant in the sense that he bleeds. So they're very, very bad. And of course there's antibiotics out there, you know, they're prescribed. There are rash creams that are very appropriate, but at the time when he has some of these rashes, they were bad twice throughout all these cycles. The other times were kind of like, they were okay, they were a little bit, so we were able to get away with antibiotics, but some of them are so big, and during that time I believe they didn't want to prescribe an antibiotic, because antibiotics kind of, they mess up your pH level. They can do a lot of certain things when because he's already on antibiotics on his own, and you're on top of antibiotics, you know, it's not always the best approach. So there was one time that they were not prescribing anything for some reason. They were just using rash creams, make sure the area is clean, and all of that. It was not neutropenic, thank goodness, so he was not prone to infection or anything, but it was they were trying to keep it under control. So I was desperate. And what happened is that since they were not prescribing anything, I decided to kind of do something about it. So I've heard many good things about the creme de la mer, which is the original cream from La Mer for dry type skins, and the one that kind of melts in your hands and your fingers, and you apply it to your face. So it's the face cream, not the body cream, the face cream. And I've heard great things about it. I've heard that some of the superstars, like some celebrities, do use it on their children's butts. It's a kind of a mystery whether it's true or not, but there are some there's some, rumors about it that Mariah Carey did this, Jennifer Lopez did this. So after hearing all this, I was like, you know what? I want that stupid cream. I want that. I also want the concentrate, the serum, which is kind of has so much of so many healing properties. So I was like chasing after it. I wanted to use them in combination. So I sent my cousin with my credit card to purchase them. So both the serum, which I've used for my face before, for my scars and stuff. So I did use it, and then I knew how powerful it was. And then the creme de la mer, which I've never used. I don't have dry skin. I never saw it to be appropriate for me, so I never used it, but I knew that it was powerful. So I bought these two products, and I immediately started putting it on. And the diaper rash was all around the butt, right? The butthole, like it was all over like this. It was red and kind of bloody in certain parts. And we were applying the serum. Every time we were changing, we were applying the serum and the cream on top, and then the Dicetin, which is the appropriate rash cream in order to seal everything in. We were not using Vaseline. And then we were massaging the serum, and then we were massaging the cream. And then we were doing this all night. After one night, this is the diaper rash cream. This is the diaper rash. Basically, the diaper rash starts shrinking. So basically, everything was starting to fade after one night of using these two products. And I was like, it's insane. I remember the doctor came in and was trying to figure out what we were using, and we advised on what we were using. I mean, we showed him bottles. It was kind of upsetting in the sense that he was saying, grandma, to my mom, do not use any products that we don't know about. Don't kind of improvise, because we don't want anything to interfere with treatment, even if it's just a cream. So I guess that's part of the reason why I didn't want to prescribe antibiotic, because antibiotics, these things interfere with treatment. They could. So everything has to have a purpose, and everything has to be monitored. So I guess they were freaking out. And I think the nurse practitioner at one point was saying, oh my God, this stuff is very expensive. So kind of she knew about it. So it was kind of funny. Anyway, we were kind of following the rules, following the doctor's recommendations. We're trying to avoid it at certain points, but then kind of we went in and we put it a little bit like in hiding, like we were kind of like putting it in when no one was watching. And guess what? It improved like in a matter of 2 nights, I think. Basically, it was completely dry, not bloody. And it was, I don't want to say completely healed, but it was not bleeding anymore, and it was kind of shrinking until there was like nothing left. It was just a little darker skin because it was healing. But again, there was not open skin, which is what burns him. So that was incredible. I was in shock, and I was very happy and pleased. And of course, the second time this happened, because it's happening when there is a specific chemo that they use, which is citrobin, I believe. It does burn the skin like crazy. It burns the skin like crazy. Like, it's one of the side effects. So it was not as bad, but it was getting there. So we did use the cream again, and I didn't use the serum. The cream did work even without the serum. I think the serum worked a little bit faster along with the cream. The cream does work, but not as fast as the serum. The serum, I think it targets really burns and heals the burns. So I think it's just very targeted for injured skin, which is what a diaper rash is. So, but I have to say I was very satisfied with the La Mer cream, even on its own without the serum. You don't need both, but definitely the serum is the powerhouse. I don't know if the serum on its own would have worked. I have no idea. I have never used it on its own. I always used it in conjunction with, simultaneously with the cream. But definitely the cream, when I used it on its own, it did help and it did heal. Eventually the diaper rash went away, but it took a little longer. It was not like an overnight experience like the first time. So even that time when I went to the doctor and diaper rash completely healed, he started saying, listen, I don't know what you're using, but whatever you're doing, continue doing it. I don't want to know what you're using, because I think he imagined that I was using that cream. So yeah, so that's my experience. I kind of want to talk about it because not to advertise it, because it's not really something that's meant to go into your butt. It's meant to something for the face. So I imagine if something that goes into your face, near your eyes, your mouth, that it is appropriate for the butt. But again, they cannot advertise as a rash cream, first of all, because it's so expensive and you go through it so quickly anyway. So there's no point in advertising it for something else. And second of all, when someone is going through such a harsh treatment and has cancer, you don't want to advertise something when it's not made for these type of situations. Now, does it hurt? In my opinion, it didn't happen. It didn't hurt my son. It helped him. But again, it cannot be advertised for cancer patients with burns because of chemotherapy, because that's not what it was designed for. Even though, again, there's history behind that cream and how it came to be, how chemically speaking it was created to help the creator's burns, right? The creator of La Mer, there's a whole story about it. So, I mean, even though the history seems to kind of match my son's needs at this time, the product itself now with that formulation is it's a face cream. It's a facial cream, anti-aging, hydrating, and yeah, that's what it is for. They don't advertise it for anything else. But I must say, if you look at the ingredients, we looked at the ingredients before putting on my son, and we looked at the ingredients. There was nothing in there that could have hurt him. There was, of course, if you put anything with exfoliating ingredients, that would have hurt him, obviously. So you have to use common sense. You look at the ingredient, there was nothing in there. There was a bunch of oils, and there was zinc. Zinc is one of the primary ingredients in diaper rash cream. So when I saw that, I was like, okay, let's do it. Let's move on. Let's do it. Let's try it. And of course, after purchasing it, I patched it on, like I used it, like I did the patch test. I used it, I mean, on me, I've used it before, like on my body. I never used it on my face, but I did test it out at the counter when I was picking up the best moisturizer for my skin. I did try it. I didn't get red or anything. I didn't get any reactions, but I did do a patch test on my son's hand or arm. I don't remember what I did it. And, it was just, so that's why I would advise, before using any products on your children that are going through chemo, make sure that you properly test them out, properly look at the ingredients, and of course consult with their doctor. Even though we kind of went against the doctor a little bit, I don't exactly advertise that behavior, but at the end of the day, you're the parent, and you know what's best for your child. And if nothing was working, and it's very dangerous. Diaper rashes are very dangerous for children with leukemia. Now, it was not neutropenic when that happened. However, if you were, you would have gotten an infection like right off the bat. I think the doctor did state that there was a patient during that time that was going through a diaper rash that was so severe that because he was neutropenic, he had an infection. The infection kind of spread all over the testicles, and it was all over that they probably had to do surgery in order to remove all the infection. And then, and it's not about the surgery. It's not about this type of infection. Of course, infections are very dangerous, but it's more so the fact that they have to interrupt chemotherapy. And so technically cancer doesn't take breaks. So taking pauses and taking care of someone's sickness, and that can interfere with treatment. So being sick and then not responding well to treatment and delaying the treatment, that's very bad. And that's part of the reason why some children actually pass, because of infections. They're not well treated when they don't respond well to treatment, to the chemotherapy, and they fall ill, and unfortunately they never recover. You cannot poison these children when they're already sick, so they have to delay treatment, they have to stop, and that causes the cancer to kind of build up again and relapses. So that's why it's really important that the child goes through smooth protocols, transitions between cycles without much of delay, because again, the cancer doesn't take breaks, so it was very important for me, fundamental, that he would not get an infection. Thankfully, all the infections that he got, which were a cold, a flu, and I guess the yeast infection, which was the most dangerous one that he got during the beginning of the cycle, those never delayed treatment. They were not severe enough to delay treatment at all. They were always under control. So I guess he was lucky in that sense. And then my son never really reacted badly to the treatment, in the sense that the side effects were always minimal, within the norm, nothing out of the ordinary. So anyway, so I kind of wanted to shout that because I want to first of all I wanted to kind of praise this brand, because there's so much negativity about this brand online. And believe me, I've used everything on my son's butt for the diaper rashes. Everything. I was going through each store, buying $30 here and there, $30 and they're very expensive, these diaper rashes cream. And I was using everything and nothing was working. And then this thing came on, and yes, it's expensive, but it worked. And you know what? Like I said, I'm not advertising in any way, but I just wanted to share my experience and my son's experience, and it just I was impressed. There's something in that cream that kind of, and that serum also, that kind of even combined together, they make a powerhouse for healing. And it's just incredible. I was in shock. And honestly, I don't think those products are necessary on a daily basis. I don't think that serum, the concentrate, is needed on a daily basis. I think those are exceptional products that, forget about the face cream that's used for people with dry skin, which I understand. About the serum, I mean, I think it's such a powerhouse, so strong, that it's only as needed. It should be used only as needed when you're really going through something exceptional, something like an eczema, something that it's overly drying, some conditions are overly drying, or a cut, a burn after laser treatments, whatever, any type of treatment that causes the burning of the skin, redness, sunburns. I think those products are targeted for situational conditions, not exactly chronic conditions, except, like I said, eczema, these type of situations. But like acne, no, of course not. If you have acne prone skin, you're gonna break out over this. If you're not gonna put on an acne spot, like I said, those are not meant for these kind of things. It's more for situational events, exceptional events, and conditions that are prone, that cause that redness and dryness, because of those products have healing properties. So anyway, so I was in shock. So I wanted to share that. If you have any questions, let me know. And of course, I'm not advertising it, but if I know that if a product helps my son and it was like very expensive, I would make any type of adjustment into my budgeting in order to squeeze it in, even having multiple jobs. I don't care. Like, you know what I mean? Like, I would do anything to make sure that my son is helped. But again, that's my opinion. And I think any parent will go through that length in order to help their children to heal, and do their best, especially if they react so well to a product, and avoid infections. Infections are enemy for leukemia patients. But anyway, guys, that's the end of the video. Thank you so much for watching. Let me know in the comments if you have used any of these products. If you ever had that experience, if you've used it on yourself, you're going through chemotherapy, you used it on your children. It's not very common. I've never seen this used before like this. So, I mean, I would be surprised if you had the same idea of buying it. But, I mean, for that purpose, which is diaper rashes. But, if some celebrities had that idea, I'm sure other people follow that idea as well. So I'm sure I'm not the only one that has done it that way. But again, for individuals that have cancer, people tend to be a little bit more cautious about using cosmetics. So, but anyway, thank you so much for watching, and I'll see you guys next time. Bye!